Welcome to MAP, the bi-weekly market access podcast hosted by me, Dr. Stefan Walzer. I am the innovator of Market Access 4.0 and a health economist by training and working in the fields of market access, reimbursement, pricing, and health economics since 2004. Discover Market Access 4.0 and unveil the future with our innovative solutions. Max Insights, our fast and easy AI-based reimbursement planning platform. Dobo, our new revolutionizing way of creating reimbursement dossiers across the globe with the first and only dossier writing AI bot. Q-Bo, our new AI-based objection handling platform. And Wafle, train with Wafle's virtual reality genius in an immersive environment and with an AI-based counterpart. We are Market Access 4.0. So check out our website, marketaccess4-0.com. And now let's dive into the current discussions, processes, and trends in market access across the globe. So welcome to another Market Access podcast episode. Today with Rodrigo Silva, actually from Chile, but nowadays you also, and especially live now also in Berlin. But Rodrigo, maybe you introduce yourself as well, just very briefly, that everybody knows who you are.
Hello, Stefan. First of all, thank you very much for the invitation. It's very exciting to be speaking here in the podcast with you. But you're correct. I am originally from Chile, but I've been already living in Germany, especially in Berlin, for the past 9 years, actually. So big part of my life in South America, but also a very important one here in Germany, in Europe.
Perfect. And the reason why we speak is I think you have also done quite some interesting research with respect to virtual reality in hospitals and the applications probably especially there, right?
Yeah, exactly. Well, to start with that, I can introduce also a bit of my background, which starts in Chile as a medical technologist, where I started gathering experience in clinical and laboratory diagnostics. And this set me, of course, with a hands-on experience on the medical field. I was working within managing devices and critical units in one of the biggest hospitals in Chile. And after that, I decided to make my way to Germany, to Berlin, where I continue with that. But then slowly I started shifting to more scientific approach and dedicating myself also more specifically to digital health tools. And within this process, I became also a master in health science, which is also when I strongly started working on digital health means and how would their implementation would work, in this case, in German healthcare settings.
Very interesting. So I think there are a lot of, let's say, different also buzzwords in a way, what you just mentioned, right? I mean, digital health, I think is obviously something we all, let's say, have discussed already a lot in Germany. But I think maybe you can also deep dive here a bit further. When you said digital health, I presume it was not so much going to DiGA directions, or was it also touching base on DiGAs?
Well, actually, DiGA applications have always been very present in my professional life since I dedicated myself to digital health means. However, the approach that I was always trying to give was more of like solutions that would be beyond any sort of application in general. So with that, I can say, for instance, I can give a couple of examples. On one of my latest projects, I was working on the implementation of digital translators, actually, that could improve healthcare services in areas where bringing a human translator or anything that it would be analog, it would be too either complicated or too expensive for the case. So obviously there are some solutions, and then when you can have a reliable digital health translator, and with that I mean reliable in terms of that is translating this critical information that is being spoken in clinical environments, but it also that it has and it provides with data protection, it can be considered as a feasible solution in such a case, for example.
Yeah, that's a very good one. I mean, I think important is probably also here a couple of aspects, right? One is, let's say, maybe call it more a digital platform, and the other one is probably more, as you said it, beyond specific applications, right? So it should be probably a bit broader, where I think maybe hospitals and also other stakeholders, especially in the German healthcare system, have been struggling in the past, right? Which was more around how to get maybe paid for it. I guess that was probably the same thing with the translators. I think whether human or maybe a digital based, I think it's still the same kind of issue with them, right? But as you said, if there's maybe a bit of a cheaper in terms of costs opportunity available, like digital health translations, probably rather. I mean, then it might be maybe still a possibility for hospitals with maybe kind of more tense budgets to use it, right?
Exactly. And that's a great point that you say there, because part of these studies of what I've been doing, or it's based on doing a bit parallel to what it's on the DIGA applications. And with that, I mean that DIGA applications are already under several studies and are covered by healthcare authorities, but there are other areas that are certainly out of that. And that's where I've been trying to address, such as these other translators, or for instance, a project that for sure we will speak also in this talk, which is about the use of virtual reality as training tool for German nursing schools.
Exactly. And that's, I think, also something you have presented at various, or at least at one conference, what I know, right? Which was quite interesting, because I think that was also, was it sponsored or co-organized by the UNESCO, for example, and a couple of other very high-stake kind of organizations, right? So what was it really then about? I mean, especially, let's say, the research project. I think you said virtual reality training tool for nursing schools. So that was more on the educational bit, very early. But even when you think about, let's say, education, it can be very broad, right?
Absolutely. So many points and feedbacks to give on that, because yes, I was recently being part of this conference, we could say, that, as you say, was quite high level. So topics were addressed in a very general way. However, it was a very interesting platform to be speaking at, because it's obviously a very international audience with many different type of backgrounds. But at the same time, all of these different backgrounds and people were absolutely and tremendously interested in what were the potentials of virtual reality, in this case, as a training tool. And there is a factor, of course, of education, which in this case, that's what experts on education also could be addressing to. But in my case, as a health scientist, is more how can we leverage this tool? What are the benefits? What are the potentials? What are the possible, hindrances, obstacles in this technology that we should consider before we even think of implementing it, or also for the future when we want to put it in action?
Exactly. And I think we're probably not so much, let's say, speaking about, let's say, the kind of transformative kind of effect within, in this case, a hospital, right? Which is also a lot of change management, a lot of that kind of stuff. But I think it's probably even a bit earlier, right? Maybe starting, I guess, from a user's perspective. But before maybe getting into some of those, let's say, discussions, maybe you can quickly introduce which kind of virtual reality education are we speaking here about? Is it rather, let's say, knowledge sharing? Is it rather really, what we know as well from pilots, right? That they basically do training on actual potential immersive realities, obviously, which is more kind of virtual reality patient. I mean, what is it? Or what's a combination of both? So what was the kind of, let's say, read topic? And then we can maybe move on to the kind of advantages to that.
Yeah, this is such an interesting question, because basically this is highlighting the many benefits that this technology, that immersive virtual reality brings along. And it depends on the case study, and depends on the context of what we are trying to address. In the case of this recent study that I just mentioned about training nurses in Germany, that was covering everything what it has to do from psychomotor skills, also acquisition of knowledge, or even acquisition of personal emotions and cognitive competencies. So the capacity that this application, that this software was offering, was directed towards that. And why do I say this? Because it's going to depend on what are the objectives of the training. There are many times where people or where institutions don't need a practical provision of knowledge and they just need subject knowledge. But there are others that need like psychomotor skills, for instance, on top of either traditional models or mixed also with combination with knowledge from virtual reality. So that was a bit of the offer that this project was offering, or like what this tool was offering, more to say, but with a certain intention, I have to say. The intention of showing this broad or complete way of utilizing virtual reality devices was to address and to measure more how was the perception of the future users. Because obviously, when anybody, healthcare institutions or authorities want to implement something like this, that is obviously an innovative tool, they want to be sure, and they cannot be 100% sure, but they want to be sure that this is going to have certain type of acceptance by the users. Because we need to understand that not only in Germany, but across the globe, healthcare institutions are working under structures and through establishments that have been already settled in advance. So many times when we want to bring something new, and this happens in every field, that when we want to bring something new, there is sort of resistance to it. So it's important that by the time we bring such a technology, we can assess and feel the pace also. What is the reception? And in this case of the study, the acceptance of this technology. And this is exactly why we wanted to show the different sort of features and the different sort of applications that this technology could be, either pure knowledge, either psychomotor skills, or even communication or affective competencies, for instance.
Yeah, got you. So a lot of, let's say, or a basket of, let's say, questions probably around it, right? So maybe we start very simply. What were your results? I mean, what was the perception of VR, or as you said it, the perception of the future use of VR in, and that's again a quick question, are we speaking about, let's say, nursing schools, or are we speaking about nursing schools and maybe then the application in hospitals? It's more the schools, right?
Exactly. And this is part of the biggest outcomes of the discussion of this study, because this was an empirical study that was conducted to about 60 nurses. And when I say nurses, I refer to, this is a mixed group of trainees and trainers. Mm-hmm. And these are nursing schools that are educational institutions, but these were linked / connected or within healthcare institutions, healthcare centers, so hospitals, so to say. So obviously they were acting as educational institutions, but within this whole context. So even though they are two different unities, they are somehow very much related to each other.
Got you.
And why is this so relevant? Because the results, going back to your questions, the results are positive. The acceptance of users, and this was measured with the methodology on the intention of use these devices. And the intention of use was, from this cohort, was about 80% of them had a high intention of using these devices. That means that that's a very positive outcome when one thinks of implementing or putting into practice these devices in healthcare institutions for this group.
Absolutely. I mean, this is really, it's really high. I think, especially when we speak, as you said as well a bit earlier, when you consider the innovative character of it, right? It's not just having another book or another way of teaching or whatever. It is something different.
Exactly.
But so what were the main reasons? Have you analyzed that as well? So what were the drivers of, let's say, that 80% basically saying, yes, we would foresee the use of that in the future?
Well, as I mentioned before, when we meet these groups of people in healthcare institutions, and this happens in my experience, I have seen it also in Chile, it's just everything is pretty much already made in a way for the past 50 years. Everything seems very established. Nothing has changed so much, and in a good way, because things work. So why would you change something when things are working? So On the first place, users get very excited and they are very positive in general when they see a technology like this coming towards their centers. And why is that also? Because even though things are working in many ways in healthcare institutions, such as in hospital, things seems so similar as in the past 50 years, as I said, there are still other things that are not working. And this is reflecting upon some of the largest obstacles that German healthcare systems are facing, which are, for instance, an intense and staggering shortage of nursing personnel. And this is actually one of the main reasons why this study takes place. Because among the many solutions that also the healthcare authorities are looking for, the digital health means count as one of the strongest one to captivate and to encourage not only current nurses to stay on the occupation, but also to bring and to attract new nurses from future students, for instance, because those are all numbers that on the path of the years keep decreasing. So actions need to be taken. Otherwise, part of the study was revealing that if nothing is done by the year 2035, about 500,000 of positions of nurses will be unoccupied. And that is adding to an increasing aging population in the country, a decreasing in the fertility rates, and therefore a reduce on the working force that is going to cover these needs in the nursing occupation.
Yeah, absolutely. Absolutely. I think that makes a lot of sense. And it's probably also related a bit to my next question, which is more a bit around, let's say, decision making, right? I mean, let's say the nurses you have discussed with are probably not necessarily the decision makers for the funding, right? They might be the decision makers to say, yes, we want to have it and we want to apply for it, right? But then ultimately, let's say they are more kind of financial decision makers, maybe at some other kind of levels within a hospital construct, right? So why, I mean, besides, let's say, the kind of, let's say, more overarching system importance, as you have just said, why should an individual hospital or hospital chain basically invest in virtual reality?
Well, that's an excellent question, because obviously, as much as I like to do science and to support healthcare systems, there needs to be a budget for it. And we are speaking about a new technology that is not necessarily the cheapest, not necessarily the most expensive, I have to say. But in any case, it is important that decision makers are involved in this process. And within this context, when I conducted this empirical study, it was very important that these people were also part of the study. So that means that we had the trainers and the trainee, we also had some authorities from each center that was taking part at this research. So because obviously there are some options, there are always, and they are currently in Germany as well, some public fundings that are being offered to conduct research or implement digital technologies such as virtual reality, but that obviously come under the scrutiny of application of this study and who has the best application and who has the best, who can get this tender better than the others. So obviously that is a challenge per se. However, some of these centers have themselves the resources to apply for it and to implement these technologies as a training tool. But obviously, they need to be convinced that it's going to work and that the money is going to be well invested. And for that, we can make this. I implemented this research study that, in a way, predict the behaviors of future users based on this cohort that I selected.
Got you. Okay. And I mean, you have said, I think you had, I think it was 60 nurses from a couple of different, let's say, nursing schools. I think you also brought in already, let's say, Germany in a whole, but even broader, right? I mean, other kind of areas of the world. So how do you see the applicability of your results, let's say, in Germany, but maybe also beyond? Maybe just take Europe, right? How could that basically apply to other health jurisdictions and or to a full kind of coverage across a country like Germany?
I see gigantic opportunities in this for the following reasons. Another of the results showed how some basic events on the perception of nurses could positively impact their acceptance of these devices. For example, there is something called the perceived usefulness of the devices. That means how can users fully comprehend how useful this device is going to be on their everyday work. And this is one of the highlights of the study, because simple facts like this, that requires also obviously a very elaborated communication toward the future users, can be a tipping point in them to either accept or not accept a device. Because on the other hand, when you go to an everyday clinical environment and you have nurses that have 1,000 things to do, that probably the least that they have is time. If they're going to invest their time on learning a new device, if they're going to make, okay, I'm going to stay an extra hour at the shift, it has to be worth it. Otherwise, I go home to see my kid, I go home to see my family, or I just go home to do nothing. But they wouldn't stay at the hospital if they don't see the perceived usefulness of this device. That is one very important factor that can obviously impact the applicability of these devices, not only here in Germany, but also in any other healthcare setting that presents similar characteristics. And another very influential factor in this, it's something called it's called the subjective norm. So with that means that the perception that the colleagues of a certain group have towards a behavior, it's also going to impact the decision of the others. And this is sort in a way of a group decision, but also understanding how do my peers perceive this, because I trust my peers and because I trust what they say. And so I want to follow that. And this is also backed up in a way in the nursing occupation, in the nursing field, in other areas. And their satisfaction and dissatisfaction is also influenced by the other peers' opinion, which is called the subjective norm.
Got you. I think that's quite interesting. I think it was also quite good. I think when you were speaking about the perceived usefulness and especially the limitation from a time perspective, obviously that makes a lot of sense. So how could I see this more in practical terms? I mean, nursing schools, I think is quite clear to me. All right, I think let's say the juniors are going to school, learning that, and they basically have another, let's say, platform available to train and to get new kind of skills, etc. I think that's for me quite clear, right? That's more in their kind of, let's say, schedule in a way. But I think what you as well just brought in was another aspect, which is, okay, nurses, like doctors and other professions as well, need to learn also, let's say, over their lifetime, right? There are new devices suddenly available, new drugs, new processes, new whatever kind of things. And then it basically, the kind of time limitation kicks in, because obviously the patient's always first in a hospital, meaning they first serve patients before they get into potential training. So, but how would I foresee that? And I'm not an expert, let's say, in those kind of processes within the hospitals, but is that more like an organized training within a hospital where maybe VR is also used? Or is it rather something where, let's say, there are the opportunities now given, maybe that's something new, right? Also part of the change management, where virtual reality platforms are provided and nurses could just take it whenever they have the time. I mean, how, maybe, I don't know if you have an answer directly from your research, but how would you foresee it?
So speaking about the implementation of these technologies in hospitals can have several layers. One can use it on a way as a complementary training tool, let's say on top of lectures, on top of going to testing with mannequins or reading books. And in other cases, and from previous literature, it has also been shown that it can be supplementary. So it has shown better results than traditional methods. So that's that's going to depend on which context are we talking about and what are the needs of this specific subject, for instance. Let's say, for example, in the area of surgery, there are several studies that prove that training with virtual reality can be even better than non-using virtual reality at all because of the following reasons. When students train with virtual reality, they can have a risk-free environment all the time. And that means that they can have repeated trainings without the fear of making mistakes in real patients and without fear of having to fail in anything else. Therefore, it is very much well used by students in those contexts. We can also not forget about the pandemic times. During the pandemic, there was times where we had to do quarantine and curfews, and students couldn't attend to their classes. And this is when also big opportunities in remote training show up. And for that, we could also get and use virtual reality devices, for instance. So I don't know if I'm grasping a bit of the question, but this is a bit of what I can imagine of the usage of virtual reality in clinical settings.
Yeah, no, that makes a lot of sense. I think it's interesting that you said. I think that literature is suggesting or showing that virtual reality training is sometimes at least showing even better results than the traditional one, which I also think makes sense. I think it's more the kind of question how you, let's say, utilize it, right? I mean, just reading a book is probably good, but if you want to, let's say, keep everything in your memory and also train your memory, it's probably good if you maybe use a kind of virtual reality kind of platform to maybe get questions and discussions or whatever. But because we also have a lot of times, let's say, industry persons listening to the podcast, I maybe want to spin that even a bit further, which is a bit outside of the hospital, right? More getting into a training tool. We all know that also, for example, there are a lot of sales reps training or training for key accounts or also other areas like compliance or so. I presume that could also be applied in that setting, because I think what you said is a very important point. You could have different repetitions when you train it in a risk-free environment, right? So you are allowed to make mistakes. Is that as well something what you could foresee there?
Absolutely. And this is such a great topic that you touch upon, because this speaks also about how expandable this technology is. And obviously, the example of training nurses that has a lot of this physical and motor skill that one can get, but we cannot forget that we can go beyond that. And what I mentioned, for instance, about the advantages of virtual reality is not only that. So we can have, obviously, a very safe environment to train. We can also have repeated practices of something. In other cases, we can get even guidance on the same simulation. And now I touch also a point and a term that we have mentioned a couple of times, but now with the attention that it needs, that we are talking about an immersive environment. With that means that we are completely isolated from the external world, and every sensation and every sound and every move that we are having throughout these goggles or throughout this headset, it's gonna feel highly intuitive and highly realistic. And not even considering that when we add other technologies like on top of this, such as artificial intelligence, large language models, avatars, and all of this in conjunction to this performance and to this simulation is gonna show tremendously good results for the user. Not only about the things that I just mentioned, but it's also like skill and knowledge acquisition. We still have if you want to train sales rep or key accounts, we can also have standardized training, and we can also, for instance, improve skill communications. Yeah. And all of this, I believe, and the studies also support this, that represent a great opportunity to expand the use of virtual reality as a training tool.
Absolutely. I think it's a lot of great let's see, pieces there. I mean, we're moving a bit towards the end, but I mean, would I a lot of times basically ask towards the end, especially let's say with such platforms we have now just been discussing, how do you foresee the future in the next 5, 7, or 10 years, maybe with a bit of a focus on virtual reality and healthcare? Maybe from a treatment, but especially obviously also from an educational perspective, maybe from hospitals / physicians, nurses, down to the industry. I mean, how would you foresee the kind of change in the whole kind of environment?
I think it is growing in a very fast pace at the moment, and institutions and possible users are realizing how effective and how useful the implementation of this technology can be. I also believe that to support the uptake of virtual reality devices as training tool, we need to put special attention on digital health competencies from users. For instance, digital health literacy. Most of the people is now, most of the society is growing and evolving in terms of digital health literacy. But ideally, we should include as many people as possible in this. And also the ones who are very capable with it, but also the ones who are not. And this way we can have a bigger universe of users and therefore more connectivity between them. Then it is important also that studies and the way that we address or the way that we implement technologies such as virtual reality, it's tailored for users. In the case, for instance, of if we're going to apply it for nurses, let's say we should make the difference between nurses trainers and nurses trainees, because both of them have very different necessities and they both have different experiences that we need to address in order to succeed in the implementation of this technology. Another very important point that we should always consider when we speak about the future of virtual reality is data protection, interoperability, and ethical considerations on its applications. I think we cannot leave any of those behind, because we need to be safe and we need to protect everyone and every data. Meanwhile, we move forward in the implementation of this technology.
Absolutely.
And if I can give just another point, is more about how do I see it in different fields than the healthcare institutions, for instance. It's also when we speak about public health education, for instance, we have seen that it's been used on outbreak investigations, or we have also seen emergency drills that have been conducted with virtual reality. Or also public engagement by public health leadership, for instance, by practicing their speeches. One can do that with virtual reality with low cost, no risk, and all the benefits that we already mentioned.
Yeah, absolutely. I think that makes a lot of sense. So yeah. So Rodrigo, thanks a lot for your time. Thanks a lot for your insights. That was really, let's say, forward looking. And let's just see how VR, AI, and whatever else might change the world, especially also in healthcare in the next couple of years. Thank you, Rodrigo.
Thank you, Stefan, for having me. Good luck.
Virtual reality in healthcare is obviously a very broad theme. So today I've discussed with Rodrigo Silva an application of virtual reality more around the hospital setting, but we also touch base obviously as well how industry could utilize, for example, such a kind of training method. As Rodrigo as well said, literature clearly shows a very good and big kind of significant impact on a better training outcome when using also virtual reality. And as I as well have just said in the kind of podcast episode, that probably also makes sense, because just reading is maybe just one component, but if you, let's say, combine it with various parts of a learning process, virtual reality can, of course, help. As also Gleb Kutepov in another episode said a bit earlier, pilots use it, for example, since many years. Anyhow, a virtual reality platform obviously needs as well various kind of components as well. It's the kind of right environment. It should be an immersive environment where people who use it as a training tool can basically see themselves in the kind of environment they basically foresee as well in reality. For example, a kind of meeting room before you present, or maybe even a kind of classroom before you present and discuss maybe your kind of educational outcomes. Maybe as well a kind of room where you meet with a patient. That depends for sure. Virtual reality, especially maybe combined, as also Rodrigo said, with artificial intelligence, could be maybe even more useful, because then you would not only have a risk-free environment, but maybe also latest information, especially maybe with an AI, which might be, let's say, safe to also upload your confidential information. As you might know, we have such a tool and such tools available. It's called Q-Bo and Wafle. So feel free, if you're interested, for a free demo and contact us. That was an episode of MAP, the Market Access podcast provided by Mars Market Access and Pricing Strategy, which is your healthcare consultancy in the German-speaking markets. MAP is available every second week with a new episode, so watch out. And in case you might have questions, contact me directly and or visit our website on www.marketaccess-pricingstrategy.de.